Thank you so much, Sunita. We'll start. So we are going to discuss the basics of communication. Okay. There was a study which was conducted by one of the universities, headache study group of the universities of Western Ontario, which confirmed that obviously they studied a lot of people having headache, and what they found out to be is that the best predictor of resolution of headache problems turned out to be the way they interacted or the way they communicated. Next slide. The patient's perceptions that they had an opportunity to tell their story. That is, they had this opportunity to say their side of the story and discuss their concerns about their headache fully with their physician kind of helped them a lot. So the study was conducted and they came to this conclusion that once we give the patients a space for them to open up, to tell about their concerns, their actual concerns of why they are having so and so issues, led to a better satisfaction amongst the patients. So communication plays an important factor when we are dealing with the patient. So, why is this communication important? Another factor is that to avoid medical errors. So, we know that a lot of times we fear allegations against the doctors, allegation against the nurses, allegation against the hospital. So, in order to avoid such allegations, a better communication must be facilitated between the patient as well as the doctor, the nurse, or whoever is dealing with the patient. For example, it could be a doctor, it could be a nurse, it could be a social officer, it could be a psychologist. So whoever is handling the patient communication, they have to keep in this in mind that they clearly say what they want to say. Like we don't give any we don't give a space for uncertainty. We don't give a space for them to assume things. So that we can avoid all the medical errors. Even if a patient is coming to us from the point of history taking, the importance of communication begins. For us to diagnose a disease, from diagnosis, coming to the reasons why they are having so and so issues, to finally coming to the intervention part. Communication is important. So 60 to 70% of medical errors occurs as a result of poor communication. This communication again could be between the doctor and the patient, or could be between the nurse and the or whoever is dealing with the patient relationship. Okay. So for example, as I said earlier, if at all there is a patient coming to us and he is saying like he is having some sleep disturbances, so immediately we are like prescribing medicines. Instead of that, we should come to a position where we like elaborate more upon why the person is having sleep disturbances. What is bothering him? Is it anything to do with the physiological side, or is it any psychological issues that the patient is having? So, in order to avoid such assumptions and interpretations and such medical errors, communication is important. So medical errors are completely preventable if at all there is a proper communication. So, doctor-patient relationship, in order to be very effective, it has to in order to diagnose accurately patient compliance, for example. So most of the time what we see is that the doctor just prescribes some medicines and give to the patient, and the patient goes off. We are not sure whether the patient is taking this medicine or not. He is just going home, and we are not sure if the patient is taking the medicines or for the patients to comply for what the doctor is saying. Communication could be a major asset. For example, if we sit and listen to the concerns of the patient, and if we explain why this medicine is important, what this medicine is going to do to him, and why it is important for him to comply to the medicines, the way the patient might take the news would be much different than just prescribing the medicines and leaving. So the patient comes and we just prescribes medicines, and then we just leave the patient just like that. It's not necessary that the patient might comply. for the patient to comply, he or she needs to know why the patient is taking the medicine. We have to like sit with the patient, explain to him the reasons and all. And effective communication also leads to better patient satisfaction. So they have this feeling that, okay, so there is this person who is going to listen to me. Okay, there is this person who actually elaborates or clears my doubts. So effective communication always results in patient satisfaction. Also, it also results in team satisfaction. For example, if obviously when we are dealing with patients, not just the doctor and the patient that is involved, the doctor will be there. There will be an entire team behind the doctor, the nurse, the social officer. So there will be a team behind the doctor. So if at all there is an effective communication, if at all the communication is very proper, there will be team satisfaction as well. For example, the doctor might be looking up to the medical side or the physiological side. The nurses will be doing their job, and there is this proper communication between the doctor and the nurse, and there is a proper communication between the doctor, nurse, the patient, and all. So the social officer will be looking upon the social aspects of the patient. So there is this team satisfaction that comes with effective communication. Along with that, safety and chances of litigations will be reduced. So communication is key to successful relationship. In communication, active listening is key to successful communication. Can someone say the difference between hearing and listening? This is like commonly we see in our day-to-day literal side of our daily life. The difference between hearing and listening. Can one of you just volunteer to say the difference between what's the difference between hearing, what's listening, and what is active listening? It's not necessary. It has to be like completely, correct, or you can just say your thoughts into hearing. So what is hearing? What is basically hearing? Anyone? You can use the chat box as well. I guess you people are just hearing and not actively listening. Yeah, I can see a few messages in the chat box. Thank you so much. So Mamta Devi has replied, active listening is very important for successful communication. Sunita Kashyap, listening to patient. Okay. So what's hearing? What's the difference between hearing and listening? So when it comes to hearing, but that's what I guess is happening in this room right now. So I'm telling a lot of things, and we just passively hear. We don't process the information. We are not in a position to comprehend, process the information, or interpret what the person is saying. And but we are hearing. Okay, we are not actively processing what's being said. So that is basically called as hearing. So this might have happened to all of us, or while we are attending classes, seminars, or even in our school days, this has been like a very common thing. So when you look at me, my body posture, my body, everything might be saying that I'm listening, but actually what's happening is that only hearing is being done. So when it comes to listening, what's happening is that I process what's been said to me. For example, there is this person who is talking to me. I actively process the information being said by the person. I try to inculcate that information into already what's existing in my mind, the information that is already in my mind, and I try to fit that information. I actively interpret what is being said. I perceive what is being said. I try to comprehend. So there is a lot of process that's happening behind listening. And I might be showing gestures, or I might be showing at least some non-verbal cues or verbal cues, which actually shows that I am listening to you. So that is called as active listening. And active listening is a very important component when it comes to communication. So what we are covering today is some positive body language for active listening. So how can you make your communication process more effective? How can you make sure that the patient feels the patient is being heard? So what are some of the helpful verbal do's and don'ts when it comes to active listening? So these are the two areas that we are going to cover. we'll start with body language. So, as you know, that body language plays a very crucial role when it comes to communication. So, even when, the way they said, the way my hand is moving, the way my face, my gestures, the way I carry myself, the way I am, the sitting posture that I am having, everything tells something about what you are saying. For example, I might be saying that I might be listening, but I'm having a very bad body posture, which exactly shows that, I'm not listening to you. I don't care what you're saying. So these kind of body postures, I mean, these things reveal a lot of what actually is going behind your head. So body posture or body language plays a very crucial role when it comes to communication. So as you can see from the picture that is being put, I can be held responsible for what my face does when you talk. So these are areas where we feel that they're not seeing. There might be slight gestures from our side which we feel that they're not seeing. But it is very evident that your disgust or your hatredness or whatever feelings you're having, it somehow comes out in your body language. So according to Albert Mehrabian's model, this is his model, which says that we feel that what we say has a very great importance, but the spoken words only take about 7% of the elements of personal communication. It only takes about 7%, and 55% of the whole communication is being done by the body language. So think about the importance of body language when it comes to communication. The what we want to convey is being conveyed. At least 55% of what we want to convey is being conveyed through our body language, instead of when only the spoken words take about 7% of the whole communication. So it is the body language plays a very crucial role. So there are some components of body language. For example, eye contact, which is the beginning and which is the most important factor, and then facial expression, tone of voice, body positioning, body posture, body space, and touch. These 7 components of body language plays a very, very major role when it comes to positive body language. So there are some tricks and tips for maintaining the eye contact. Obviously, the eye contact is a very first and the basic element of maintaining a relationship or establishing a relationship is eye contact. It's not just a patient doctor patient nurse relationship. Any relationship, to establish any relationship, proper eye contact is mandatory. So you cannot just you might have seen that okay, there's this patient who has come to see me, okay, who has come for a session for a session for and I'm not looking at him. Okay, I'm not looking at him. I'm just taking some few files and just going through the files. I'll be reading his file, what his concerns are, without even once looking at him or looking at his eyes, without even once giving him the eye contact. So this gives a very bad impression about the person who is talking to the patient. The patient gets a very bad impression. Okay, so this person is very busy, I guess, or maybe the person is not very warm. I may not be able to trust this person. So there might be a lot of other thought process that goes behind the head of the patient when we don't give the eye contact. So whenever the patient comes, make sure that you properly make him sit beside you or is standing at your eye level, and you maintain good eye contact. Okay, and it's not something like you look up suddenly, like in a way that frightens them. It's not necessary to frighten them. When you look at your patient, make sure that it's a very slow and very soothing kind of look. Very slowly you look up to him. So don't look down when you look away. So obviously it might not be possible for us to continuously maintain the eye contact. So there might be at least some instance where we might have to take our eye contact, or we might have to take our eyes away from the patient. So don't just look away abruptly, or don't just look down suddenly. Whatever movements you're making should be a very slow, gradual, and gentle kind of movement. So maintain eye contact while the patient is here. And if you want, if at all you want to look away at the file or something, make sure that it's very gentle and very slow, and don't ever look down. So rather than, and obviously, it's understandable that, if at all there is this patient and he or she is describing a lot of things that has happened, and it's normal for us to, at least, our mind to fly away for some time. But make sure that you don't look away from the face. Make sure that if at all you want to look away from their eyes, make sure that you look around at some other point of the face. Okay, for example, it could be the nose, it could be the lips, or somewhere around the face, but not away from the face. So if you want to move your gaze away from the eyes, make sure that you look at some spot in the face, on their face itself, and rather than looking away. So break your gaze to make a gesture or to know. So if you feel like, okay, I have to break this gaze, I have to look away. Okay, you can just use the head notes for that. So make eye contact before you start talking to someone. So eye contact is very mandatory. It helps us in establishing a proper relationship with the patient. It's not just the patient, with any person. If you're trying to establish a proper relationship, the beginning itself starts with the eye contact. So there is something called as good triangle. There is something called as good triangle, that is the eyes and the lips. Okay, this part holds the good triangle, both the eyes and yeah, sorry, so sorry. Thank you for making me realize that. Thank you, Sapna. Okay. So there is something called as good triangle. Good triangle forms this both of your eyes and your lips. So these are the both the eyes and your lips form the corners, and it would be more like an inverted triangle. So if at all you want to look away, if you want to like have your gaze away from the eyes, you can look anywhere near this triangle area. So the patient will feel that you're actually looking at them. Maybe you are taking a moment away from the gaze. So the good triangle, you always remember. There is this picture. I think it kind of missed. The good. If at all you want to look away, make sure that it's somewhere around your face or around this good triangle. Smile. Okay, there is something called as professional smile, which needs to be inculcated in our day-to-day life. It could be, it's not necessary that it has to be a proper, you're not just smiling at the patient. Okay, this has to be a habit that we develop. It's a skill that actually we develop. It could be smiling at your colleagues. It could be smiling at the security guard who is there at your hospital. It could be smiling at one of the housekeeping staff. It could be anyone. Okay, but smile does a lot of wonderful job, which is beyond comprehension. Okay, so even if you are wearing mask, the eyes could be seen in your eyes. Okay, the smile could be seen in your eyes, and it could be heard in your voice. So if at all you're wearing a mask, make sure that you smile. And obviously, even if you are, it could be seen in your eyes, because our eyes kind of shrink when we smile, and it could be seen, and it could be, they would get a very warm welcome from the way we show these gestures. And maybe you can just have a slight sound to it, it's so that they feel, they hear it. Because if at all you're wearing a mask, they won't be able to see the smile. So at least they will hear this. So make sure that it's seen in your eyes and it's heard through your voice. And this the professional smile is something that has to be practiced. You might need to actually deliberately do this, make into practice that you smile often. So, as I said, the tone of voice and smile kind of goes hand in hand. Okay, because for example, see, I'm smiling. Okay, I'm smiling. I'm wearing a mask, and I'm smiling. And when I talk when I smile, it could be obviously be very gentle and very calm, and it could be very pleasant. Okay, so if I'm smiling, obviously my tone will also be that much pleasant. And if I'm having a very grumpy face, I'm not smiling, I'm having a grumpy face, obviously the tone of my voice will also be grumpy. Okay, so that's the importance of smile. So tone of voice comes along with the smile that you're having. So wear your smile, and when you smile, obviously the you're smiling, and the words that come from you will be obviously be pleasant. And if you're having a very grumpy face, your voice, your tone, everything is going to sound grumpy, and maybe the patient won't feel much comfort in having a conversation with that kind of a voice. And the next thing is obviously when it comes to voice, we have something called as there might be certain points, certain areas, certain situations where we might have to sound. We cannot smile. For example, there is this. We have to break a bad news, and at times it's not possible to. Obviously, it's not something that we can smile. So that entire conversation takes a different tone and different levels of speaking on saying, which will be dealt in the next session. Okay, these things I'm saying in a very general mode. Body positioning also plays a very important role when it comes to communication. For example, we always need to be at the level of the patient, at their level. So you can see in the first picture. Okay, can someone just volunteer and say something about the first picture? How the doctor is talking to the patient? Is it a very good positioning that they are having? And when it comes to the second picture, how is it? Can just someone just sit and comprehend these two pictures for a while and say something about these two pictures, the right and the left? You can use the chat box. So can one of you just say, okay, we'll take the first picture. Okay, who is going to volunteer?
Myself.
Sure, Shani. Sure, ma'am.
The first picture, the doctor is standing a little higher than the eye level of the patient.
Exactly.
As opposed to the second one, which may be uncomfortable for the patient to look up and speak all the time. And while the doctor is looking down, it's not an acceptable or not so okay position, but that happens almost always. The second one is the team is sitting at the eye level of the patient who is lying down or who is sleeping. I mean, who is lying down, and this is quite I would say acceptable position, eye level. And the third one is especially for a child, it's a must. And this doctor is doing very well for talking to a child.
Exactly. Thank you so much, Shani ma'am. So as ma'am said, in the first picture, as we can see that, there is some kind of strain in the patient. The patient is actually leaning forward, is bending his head, and he has to look up. So there is a lot of discomfort that is there in the first picture. So if it's mandatory that we maintain the eye level so that the patient is like very comfortable. If at all there is no space for you people to sit, or there is no place for us to have that eye level contact, make sure that at least you stand at the foot end of the patient so that the patient is like comfortably lying and has a very clear eye level contact for the patient. Okay, if at all there is no space for you to sit, as a team for you to sit, even if it's a doctor, nurse, or whoever it is, if at all there is no space for you people to sit, make sure that you at least stand at the foot end of the patient so that the patient is comfortable, is lying, and is having the eye level. So the second picture is how the communication should happen. Here, the patient is comfortable, is lying in a very comfortable position. The eye contact is at almost at the same level, and the patient is also feels like, okay, the patient also feels comfortable, or maybe, and this feels okay, or else the patient might have this feel, okay, this person is having some higher authority, or having that space between us, or even otherwise physical discomfort will be there. So here the whole team is sitting, and we can see that the doctors are also relaxed. So sitting means the patient feels that okay, the doctor is relaxed, is comfortable, is having some time. When you just stand and talk, that the patient also gets this idea that okay, see, I have to leave at any moment. Only I have just a very brief moment I have to spend with you. So when you sit, it also gives a notion or an idea that okay, I'm here to speak with you, and I'm going to be here like for about 5 to 10 minutes. I know this is not practical in a very in an OP where there is a lot of patients, or in a ward where there's a lot of patients. But when it comes to palliative care, palliative settings, make sure that you have some time to spend with the patient, and you sit comfortably, you may and talk at the eye level, and this leads to better satisfaction. This body leveling leads to equality, and which leads to patient satisfaction as well as the doctor satisfaction. And the third picture is obviously we have a tendency to look down at children. Okay, we have to bend forward when we are dealing with children, or when we are communicating with children. So which is not a very good way of communicating. So what we would suggest is that either you have to be get on your knees and talk, or maybe similarly, just like the second picture, you can use a chair or something to sit on, so that we are at the level of the children, and also they also feel the same comfort and comfort just how we previously discussed. Okay, so this has to be in our mind, that we don't stand just beside the in a way that makes the patient discomfort. Body level, eye contact, eye level, the patient, the eye level is important, even if it's we are communicating with adults or when we are communicating with children. Okay. So in this body posture, obviously the picture is self-explanatory. I would say. So okay, there is this person who has come to meet me. Okay, so I'm gradually, even if I'm taking this session, I'm just lying behind. I have put my legs over this table or legs over my leg, and I'm taking this session. And this won't give a very good idea of how we are dealing with the patient. For example, the patient has come and sit beside me, and I'm just sitting very lazily. I lean back, I play on my phone, or I'm drinking something else, I'm looking somewhere else. This gives a very bad idea, and it won't. The patient himself might feel that okay, see, there's no use of coming here, or they won't feel very accepted there. So always have this bent forward, have this steady body posture, so that which gives off the idea that you are willing to listen. Okay, I'm here. This gives an idea. Okay, I'm here to listen to you. I'm all ears. You can say whatever you want. So the bending forward gives that notion, gives that idea to the person, whoever is listening to you. So bend forward when you're talking. Body posture is important. Bend slightly forward. It's not that you're completely bending over the patient. A slight bend is recommended. So bend forward, which shows that you are willing to listen to what they are saying. So they indirectly get the cue that you are willing to listen. You're not actually saying you're listening, but this gives off a cue that you are willing to listen, which again results in better patient satisfaction. Okay, again, leaning forward, and if at all the patient is leaning back, you can lean back, and if the patient is leaning forward, you can lean forward. This is called as mirroring. So mirroring of the person who is in front of you, you make yourself likable. So if we are kind of not taking all the gestures that the person is doing, at least some of these movements, if we like mirror what they do, they get this idea that you can make them likable. You can make yourself likable to them. Not all the gestures. Please note, you're not supposed to mirror all their gestures or actions that they do, but slight gestures, like okay, when they are like leaning forward, maybe when they are getting much serious about what they're saying, they might lean forward or they might get excited. So maybe you can also show that leaning forward, so that it gives off the idea that okay, you're also excited to listen about it. you are ready to listen of it. And when they are like relaxed, maybe you can also take a slight step back, not completely relaxing, not completely bending back, but slight, instead of this leaning position, you can just take a slight back if the patient is also taking a step back. So mirroring the slight body postures would make yourself likable. So obviously we have to, there is something called as body space, which we would be much familiar to. And respecting this body space is very important. So we have this intimate space where we allow only very few people, very, very, very close people. Most probably it could be our spouse or parents inside that intimate space. And then we have our personal space where we might have our close friends, family members, other family members, and then we have the social space where we yes, thank you, Shani. So then we have this social space where it's like, we, the colleagues that we meet, the persons we meet at the hospitals, or where the social engagement happens. Okay, so that is our social space. Then we have the public space where there are strangers. For example, if you're standing in a bus stand, or if you're standing in somewhere else, there is this other strangers are also there. So that space where the strangers are also there is called as a public space. So when the patients come to an OP or come to us, either it's doctors or nurses, we are somehow invading their space, personal space. We are actually invading their personal space. And we don't seek any consent for this. We directly go and touch and take the vitals. Everything is being done without any consent. This, obviously there is this implied consent because they themselves are approaching us because they're having some concern. For example, there is this patient who is approaching me because the patient is having a headache, or if the patient is having some other issues, a cold or whatever it is. And obviously their consent is there. They are coming by themselves. Okay, implied consent is there, but that does not make it grant you the permission to invade their personal space. And if at all you want to take the vitals, you want to check, make sure that you inform that you take their consent, and you inform what you're going to do. See, I'm going to, for example, if it's a catheter change, or if it's Riles tube change, whatever it is, even if the patient is bed bound, even if the patient is not verbal, even if the patient is completely what do you say, paralyzed, or is quadriplegic, or having is paraplegic, or whatever condition the patient is in, make sure that whether he listens to it or not is not our concern, but make sure that you tell them, I'm going to insert this catheter. Okay, like or I'm going to insert this Riles tube, I'm going to change, or I'm going to remove this Riles tube, I'm going to remove this catheter, I'm going to do this. So make sure that you inform prior what you are going to do. This actually decreases a lot of discomfort that the patients might experience. It's not necessary that they might say, because it's because obviously they see upon us, the doctors or the nurses, whoever is treating them, as someone who is having higher authority. So it's not necessary that they might say they are feeling discomfort, but it obviously, there's this person who is invading my personal space. Okay, I'm definitely going to feel discomfort, right? So it's normal to all of us, right? So in order to avoid that discomfort, whether the patient is verbal or not verbal, make sure that you take the consent, or you say what you're going to do beforehand. Okay, I'm going to change this. Okay, so please be comfortable. I'm going to remove this catheter, or I'm going to insert this catheter, whatever it is. Make sure that you inform that prior. So yeah, as you can see in the first picture, you can see that the doctor obviously is standing and is in the corridor, which definitely gives off the idea that he is very busy. he was maybe doing something else or going to do something else. In the way he saw the patient, maybe he stood there and is invading his personal space, and the patient is like, leaning back. We can see that there is some kind of a threat or some kind of a discomfort that is there in the patient's face. He's leaning back because he feels that he's being invaded. The personal space is being invaded. And you can see in the second picture that it's the eye contact is proper, the body level is proper, is correct, and the patient is very comfortable. The doctor or the other professional who is sitting beside the patient is also comfortable. They are smiling. So we can see that there is mutual respect in the second picture when compared to the first picture. So whenever you are having a conversation or you are having a communication with the patient, make sure that you sit, you are comfortable. It's not that you're just rushing over things. Make sure that the patient feels he is being heard or he is being attended to, and the smile, everything kind of has its own role to play when it comes to communication. So make sure that you smile, you are at their level, you maintain the proper eye contact, and you communicate, which leads to very effective patient satisfaction. Touch. After COVID, it has been seen that, especially after COVID, this has like come down drastically. Okay. This therapeutic effect of touch has come down a great deal. And we never knew how much therapeutic it is to have a warm touch. I know that it's sometimes we do feel that, at least if you people have worked completely in a proper hospital setting and not in a palliative setting where you have like had this training and all, it could be very, what do you say, especially if it's the doctors. Okay, I know that nurses are like more warm and have an open mind to it, but at least we have seen some doctors having not so open mind towards touch. But this plays a very key role, very therapeutic role when it comes to communication. And I know that sometimes we do have this idea that, obviously it could be, we might give some infection, or we might transmit something, or we might get something. So it is possible, but at least we know, we can use sanitizer, we can use whatever is available, and it is completely fine if you are using sanitizer after touching a patient, even if it's in front of the patient. Okay, that is completely accepted. But make sure that you have that touch. Maybe it could be just a warm touch or a warm hold on the patient's hand, maybe a pat on the patient's back. It could be anything, but the touch plays a very it has a very therapeutic role, which is not otherwise described through words or other verbal or non-verbal gestures and all. It gives them this feeling that, okay, there is this, I'm comfortable, there is this person for me. Maybe a single touch would, I have seen patients, come to me, and maybe till then the patient might be okay, the patient might be about to vent out, but the patient is not willing to vent out. The cry, everything is, we can see that they are in tears, they are going to break out completely, but they are somehow holding back. A single touch, if I just hold the patient by the hand, or maybe if I just hold them by the shoulder or pat them, I can see these tears coming down, rolling down like anything. They went out like anything. So it gives them the space to actually express their feelings. A single touch would make them express what they are feeling. And now we're coming to some verbal do's and don'ts. So till now we were dealing with body language, and when it comes to body language, we started off with the primary, the core thing that establishes the relationship, that is the eye contact, and then we move on to other non-verbal cues like how we maintain, or the posture that we have. So the eye contact, the body posture, how we stand, how we should stand if we are in ward, if you're taking rounds in ward, or even if you are in OP, how we are supposed to take our body posture when we are talking to children, and how to make them more comfortable, the tone, the importance of smile, the importance of touch, how all these key components play a role in having a very effective communication. Now we are going to deal with verbal do's and don'ts. So most of the time what we see is that we directly or indirectly give them the answers. For example, so I have yesterday there was this patient who came to me for breathlessness. So I prescribed some medicines. The patient went, and the patient came back to me today. And I would be like, even before the patient has something to say, I will be like saying, I am implying, okay, I'm saying that, okay, your breathlessness is better, right? So I'm stopping the patient from from actually saying what he or she wants to say. Okay, so I am myself giving answers or assuming answers for the question that I asked. We are just breaking, we are just shutting down the patient from actually speaking. This is known as leading question. So your breathlessness is better, right? So you slept yesterday, you slept better yesterday, right? So you know the medicine is working, right? So indirectly we are suggesting an answer where the patient might, if at all the patient took the medicines and if the patient is not feeling better, the breathlessness has not come down, even then the patient might be feeling okay, the doctor is saying that it's better, maybe it is better, maybe I'm not feeling it's as better, maybe I'll just nod my head, I'll just say, yeah, it's much better than yesterday, but actually it won't be the actual answer. So these are known as leading questions. So we should never ever ask leading questions in a way that gives off the answers. For example, like, isn't it right? You're feeling better, right? You slept better, right? So these kind of questions should be avoided, and more open-ended questions should be asked. For example, how are you today? Like, how are you feeling today? How is your breathlessness today? You know, which gives them an opportunity to actually say what they're actually feeling. You know, it gives them a broad space where they could actually say how it is, how even otherwise how the patient is feeling. So it gives them the space to give reasons, we can elaborate more. So they avoid leading question or close ended question where we'll be just getting yes or no answer, isn't it? It could be yes or no, right? It could be yeah, it is better or it is not better. So it could be yes or no, it's close ended questions. Okay, but when we ask open-ended question, for example, how are you today? You know, we'll get a lot of other information which otherwise we won't be getting, which we won't get in leading questions. So avoid leading questions and prefer more like open-ended questions. Always prefer open-ended questions like how are you feeling? Why is it so? Why what was it? What was it? How was it? So these kind of a why, how, when, where, you have to like elaborate more on the issue than asking leading questions or yes or no questions. Don't minimize or don't compare patient's problem. So never minimize the patient who has come to you with a pain. I'm dealing. I'm an oncologist, and I have been dealing with patients with cancer for like 5 to 10 years. And there is this patient who has come to me with a toothache. Okay, but can I say that, I have been treating cancer patients. I have seen severe pain for the past 5 to 10 years. So your pain is like, it's when compared to that, your pain is nothing. Can I say that to a patient who has come to me with a toothache or something? Never. Because when it comes to the patient, for him or her, the toothache is his biggest issue as of right now. Is the biggest pain as of now. He is not worried about cancer. He is not worried about anything else. He is not worried about anything else. For him, at present, his toothache is going to be his biggest pain, and we should never minimize what the patient is expressing. We never minimize the problem that the patient is coming with, and never compare. why are you crying for this toothache, or why are you crying for this headache? See, there are severe people. There are people who have come to me with severe pain. Maybe there are children who have come to me with severe pain. So your teeth toothache, we have this tendency to compare. If at all we are not telling directly, at least we have this tendency to think like that. So never compare, never minimize their problem, and never compare. So they, once we do that, they feel that we don't care. They feel that you don't care. Okay, so I have this terrible toothache for the past 5 days, and have finally come to a doctor, and the doctor is saying that, see, there are other people who are having severe pain. And if at all the doctor says like that, the patient feels that you are not being cared of. The doctor doesn't care much, or the doctor, it's better if I don't go to the doctor at all. So they have this feelings. So in order to avoid that, never minimize whoever is coming to you with whatever issue or whatever problem. For them, it is of the highest priority, and it is of the highest importance. So always acknowledge and normalize patient's emotional experience. So you have to acknowledge and normalize. So you have to say that anybody in your position would perhaps feel this way. It's not some it's I know I know that it's what you're going through is like a tremendous. And I know that it's pretty hard for you to go through so and so. I do acknowledge, we are acknowledging what the patient is going through. It's not that we are immediately comparing the pain and all. We are acknowledging. No, I know that it might, I know that it might be difficult for you to go through all this. And see, we are acknowledging there, that point itself will give us a very a space where the patients feel comfortable. So considering what you're going through, it is normal to feel this way. So I do acknowledge the emotional experience that you're going through, because you're going through so much. So it is normal to feel angry, it is normal to cry, it is normal to feel so and so, because you're going through so much. So we are acknowledging or normalizing patient's emotional experience, which the patient is actually craving for. The patient may not get this acceptance, may not get this acknowledgement from anywhere else. It is going to be through the doctors. And if at all it comes through doctors and nurses, or the people who are treating the patient will feel happy. The patient will feel, okay, I have this space, I have this place where I can actually say or convey my feelings. So considering what you went through or what you're going through, it is normal to feel angry. It is normal to feel angry towards God. It is normal to cry. It is normal. So you are going through so much. So we have to acknowledge and never minimize their issues or never compare. Never ever give false hope. We have this tendency that, not to worry. In Malayalam, if we are translating that, we have this tendency to say that, okay, everything is going to be all right. You don't worry, everything is going to be all right. And this somehow gives the patient a very wrong idea that, okay, like, it's somewhere it gets registered that, okay, the doctor, see, when from the patient side, they see us, the people who treat the patient, as having an higher authority. Okay, so when things like this, like, everything will be all right, comes from our mouth, they completely digest it and completely implant it in their head. And they feel that, okay, everything might end well, or everything is going to be all right. So actually the person might be having a very bad prognosis, might be in a deteriorating condition, or the patient might be in EOL or end of life care. But giving the false hope either to the patients or the caregivers or whoever is with the patients that everything is going to be all right is not going to help in any way. So do give realistic hopes. Your disease may be progressive, but I will do my best to keep you comfortable or pain free, or we'll try to do our pain management as long as it is needed. So whatever you're saying, make sure that it is completely facts, and you're never giving false hope. And there is clear communication between you and the patient or the caregivers, and in no way there is hope. There is place for false hope. Even it could be simple words like, We are there with you. We'll completely take care of you. See, we know that what we can do, right? So we might have an idea of what we are going to do with the patient or what the patient's condition is, whether the patient is deteriorating, how long the patient will be. We might not be very sure of how, like maybe 3 days or 4 days. We cannot never say that, but at least we know that how the condition is progressing, whether the patient is in end of life, whether the patient's condition is bad or very much deteriorating and all, or if the disease condition is progressive and all. So convey that exact facts to the caregivers. There is a way in which it has to be conveyed, which again we'll be dealing at the next session, which is breaking the bad news. How we convey this news, if at all the patient is in end of life, how we convey this news to the caregivers or the patient, and how we go about the whole communication thing is an entire session which we'll be dealing in the next session. But make sure that never ever you give false hope. Whatever you are saying, it could be a realistic hope or it could be completely facts as such. So do not assume. We have this tendency to assume things. We have this tendency to assume before the patient says. We have this tendency to assume, but never assume. Ask, clarify, have, if at all there is, if you need some clarity, ask the patient, have a proper communication and not assume. So here, do not assume. We tend to ask, like, do you have satisfactory? Back. Yeah. So we have this tendency to assume. How is your breathlessness? Much better. Okay. In the next thing, we can see that, do you have satisfactory relief? So we are exploring more. So the patient is saying, not really. So we are not assuming the patient is feeling better. We are not assuming the patient is okay or the medicines is effective. We are asking the patients themselves how they are feeling, whether they have any relief at all. So we'll get a more satisfactory answer, more correct answers. Next, please read it. Sorry for the delay. Yes. So, so history taking, we are towards the end of communication part. So the next portion is history taking. Obviously, when a patient comes to us for registration or comes to us with a problem, there is this long process that we do from history taking to the intervention part, everything covering everything. So this has three major parts. The medical story, obviously, we need to know. There might be this patient side of story that we might need to listen to. We might also need to probe upon the patient's insight about the disease. So when a patient is coming to me or coming to you people, obviously the first and foremost thing is going to be eye contact. Make sure that once a patient enters your room, make sure that you have the proper eye contact and you're not looking at your files or papers or your phone or nothing at all. You're directly looking at the patient and you smile, you nod your head, you ask them to sit. And whatever is the way in which you receive people at your state, it could be namaste, it could be good morning, whatever, namaskaram, whatever it is, you give the salutation as well. So once the patient enters the room, I give a proper eye contact to the patient so as to make sure that I make sure that they saw that I had this eye contact with him. I'll have this eye contact. I will smile and I'll nod my head as an acknowledgement that I have seen you enter, and I will ask them to sit comfortably. And okay, I'll receive with a salutation, whatever is appropriate in your home state. And I'll obviously make them comfortable by offering a seat or something, so that we are at the same level, and it's a same level and they feel comfortable and they are in a better environment. So I'll start my interview or I'll start my communication with an open-ended questions. For example, how may I help you? Like what, obviously the patient might be having some kind of a physical trouble, or else they won't come to a hospital without any issue, right? So obviously we know that the patient is having some physical disturbance or physical issue or physiological issue, but I will start my conversation with open-ended questions like, how may I help you? Or what brings you here? What brings you at OP? What brings you at my OP? Or what brings you, how are you today? It could start with any of these questions, okay? So I'll start my communication, the whole process of communication with open-ended question. And I'll listen without interrupting. So I think there is a study which shows that there is this tendency amongst doctors and doctors. I think it was done with the amongst the doctors, and the study shows that the doctors interrupts the patient within the 10 to 15 minutes of the patient communication. You know, we have this tendency to interrupt the patient, stop the patient of what they are saying, and involve or intervene in between. So do not interrupt. Do not interrupt. Listen to whatever they are saying, and encourage the patient to talk, maintain eye contact throughout, give slight gestures, notes, etc. Nod your head. Make sure that you're not taking all the files in between, reading those files, keeping it aside. Taking a phone call in between, which gives them a very bad idea that, see, I'm very busy, I don't have time for you. And this is going to be the patient will feel, okay, the patient, it's not necessary that I have to say my other issue, emotional side for this towards this doctor, because he or she is very busy. So we are not supposed to do any of this, which gives a very bad idea about us. So maintain eye contact. Do all those unnecessary things. If at all you need to take a call, make sure that you tell the patient. It's forget about patient. Okay, even if you are talking to another person, even if I'm talking to Sri Priya, and in between there my phone call rings, and I will just I won't just suddenly take the call. I'll just let her know, I'm having this call. Shall I take this call? So even if you're having a normal conversation with any person, make sure that you take their consent and take the call, which, or else it gives a very, the patient is sitting in front of you, and he or she sees you as somebody, who's there to help you. And there is this phone call that comes up, and I'd say that I get this feeling that, okay, I won't say about this thing. I'll just leave this thing. Maybe he is busy or she is busy. So I'll just leave this out. So never do that. Never interrupt. Listen continuously. Listen. Encourage the patient to talk. Do not interrupt. Maintain eye contact. Nod your head from time to time, which shows that you are listening. Make encouraging sounds like, huh, okay, go ahead. We have those slight sounds which shows that we are listening or we are acknowledging. Clarify as you go. Never leave space for uncertainty. If at all you don't understand what the patient is saying, make sure that you clear that and go ahead. I did not understand. Can you repeat what you said, please? Can you repeat again? Prompt us. Yes, thank you. Ask about what they understand about the situation. What did the doctor there tell you? For example, the person might be coming to you already with a report from somewhere else or from the scanning report. So the patient might having some idea of what the patient is going through. So maybe you can just probe the patient's insight. How much the patient knows about his condition, or what the patient, or at what level the patient is right now about his or her condition. So you should ask, like, what did the doctor there tell you? Did the doctor say something about this? Do you know what the report says? So obviously, if at all, if even at today's era where you have mobile Google, and also we tend to search everything. So we, even before coming to the doctor, we might have some idea of what the report says. So the patient might having some idea of what he or she is going through. So if at all the patient is, you have to probe into the patient inside. How much the patient knows about his or her condition? Do you know what the report says? So we'll get a basic idea of the patient's insight. Ask about their concerns. So what are your major concerns? So for example, if the patient says that he or she feels scared, so we'll probe more into it. So what is it that you're scared of? Is it if the patient is in end of life, is it death? Or most of the time, it's not necessary. It has to be death. If it could be, if at all something happens to me, I'm not worried that I might die, but I'm worried that if at all something happens to me, who is going to take care of my children, or what is going to happen to their future? So we might need to probe into their concerns to what actually is bothering them. I'm just giving some examples. Not necessary. It has always to be related to that. It could be anything. It could be maybe I'm not able to work properly. I'm not working properly in my work setting. It could be anything. So ask what are your major concerns as of now. So eye contact, we'll have the eye contact, we'll greet, we'll ask the patient to sit, we'll listen, we'll encourage the patient to talk, we'll clarify, there will leave no space for uncertainty. We'll check the patient's insight, how much the patient knows about his or her condition, and we'll probe much into their concerns. And as we said, we'll share information very honestly, using no medical big jargons and all. We won't use any big jargons. We'll say in a very simple language, in a way that they understand. And we'll only be saying actual facts, and we won't be saying any false hope. Okay, we won't be taking the results or reports and saying that, oh, this seems fine, it's okay, when actually the patient is deteriorating or the patient is having meds. We won't be giving them any false hope. Whatever information we are giving, it could be facts, it could be completely, there should be honest communication between. Discuss treatment options. So what we usually have this thing that we decide for them, we decide for the patient. So in order to avoid that, we give them choices, or why this treatment is important, why you have to choose this, or what are other alternatives, what are there. So discuss with it. It's not just a patient, maybe it could be the caregivers also. Recommend a line of treatment. You are more than a prescription vending machine. So you are not just a person who is going to sit there and prescribing medicines and just leaving it off there. You are saying why you are prescribing this medicine, why this is important, and how this is going to help in his or her condition. And if at all this is not an option, what other options are there? So we are completely, discussing the treatment plan. It's not just we are just prescribing something and leaving it off there. Listen to their beliefs. So we people come from different belief system, different environment, and different situations. So we all have different beliefs, fears, problems, constraints. For example, I might be a person who is completely religious. Okay, there is this patient who is completely religious, and I believe in doing some rituals to treat myself. So we it might be difficult for us to completely break it, but you have to sit with them. See, saying is your part. Why this is important? Why taking chemotherapy or radiotherapy is important? Why taking this medicine or morphine is important? We might need to explain to them what the actual thing is. To choose it or not, obviously, is their concern. We have to do our part. To whether to go about with it or not is their choice. We cannot just force things upon them. Participatory decision by consent. The patient will be there, the family will be there, the doctors will be there. So we'll be like sitting together and taking a treatment plan and summarize the whole thing. Okay, so and so thing is that summarize the whole interview. Confirm the treatment plan, including next visit. Make sure that you completely say what the treatment plan is and when he or she has to come again. Before you close the interview, is there anything else you want to ask? There might be certain fears the patient might be having. How long am I going to live? Or is this going to take my life? Or there might be other things that the person might need some kind of an insight into. So just before closing the interview, make sure that you ask them, is there something else you want to know? Is there anything else you want to ask or say? Is there any other doubt that you might need me to clear? So close the interview, leaving the door open. In case you need to contact me or my team, you can call at the given number. Make sure that you don't tell, you can call me at any time. That is not a very proper way of saying. You can say that, I'll be available from so and so time to so and so time, and so from so and so days to so and so. These are my available times, or I'll be, you can directly come to the hospital or the IP or the OP. So leave the door open. Greeting. Yeah, make eye contact again, smile, nod your head, and say goodbye or namaste or whatever it is. So some of the takeaway home messages. Empathy as an experience depends on how we behave with our patients and their family. So see, we empathy obviously means acknowledging them, and it's not just sympathy that we need here. We need to empathize with them. So there is much more than sympathy that we need to do here. Patients and family remember how they were made to feel. It's they always have this idea. Even it could be a very normal communication where the intervention was nothing. Intervention was very low. The treatment was nothing was done, but the communication alone might have helped the patient. So the patient and the families and the caregivers always remember how you made them feel in the first few visits. Okay, so it is very important how we make them feel, how comfortable we make them feel. That's mostly what they remember. Talk less and listen more. Practice positive body language and remember the verbal do's and don'ts. So, the most basic of all human needs, they need to understand and be understood. The best way to understand people is to listen to him. So, listening forms the core component of communication. Listen. Everybody needs somebody. Everybody hopes that there is someone whom there will be somebody to listen to. Everybody has concerns and everybody needs a listener. So be a very good listener, and you might actually get a lot of information just by listening and not intervening, interrupting, and all. So that's kind of the end of the session, and we'll just go through one video and come back and discuss regarding that video. Okay. I want all of you to actively listen and observe the video because there will be questions that will be followed. What were the things that happened in this? Was it a very good communication that happened? What are the do's and don'ts that happened? Any one of you? No, it was not a
No,
good
ma'am.
communication. Yes.
The
Yes.
नॉट ए
Can
गुड
I?
कम्युनिकेशन बिकॉज उसका फोन बैरियर था उसमें गुड कम्युनिकेशन में.
हाँ, फोन बैरियर था और कुछ?
She was, may I speak?
Yeah, sure. Go ahead, please.
She was not interested in even sitting for a couple of minutes. She could have, the time she spent, she could have spoken to the patient. She was hurried, and one is eye contact was kind of very distant, and she was not empathetic. She dismissed patient's sleeplessness.
Mhm.
Yeah, and this, and also the last thing was she did not give any kind of follow up.
Thank you so much. Anybody else would like to add to this? Asha was not listening properly. Yes, Kriti. No one, no open-ended question. Expression not interested. Uh, Thank you so much. So, yeah, no sympathy, no empathy, exactly. So, I would just like to add here, all the points you have covered all the points. Above that, she also kind of blamed the patient. She just assumed or said that you might be sleeping during the day. That's why you're not able to sleep at night. Already the patient is having a lot of pain, and the patient is trying to communicate what he is feeling. But above that, she is blaming the patient, and forget the patient, she is also blaming the caregiver. So looking after a patient who is bedbound is a tedious task, is stressful, and there is something called as caregiver burden that comes along with this. And exactly, thank you. She complained about the wife. She complained that the wife, maybe you're not giving him proper food. So already the patient might be going through some caregiver burden, and this burden is kind of added upon. So a lot of other things, for example, the eye contact was not there. Other things have been covered. We'll just go through what all the things that has to be avoided.
Avoid the following to improve patient.
And and acknowledging what the patient is going through and is more comfortable, is not in a hurry burry, is having all those elements of communication that we already discussed. So we'll see what all those points are. That we come to the end of our session. Yes, thank you. Any other doubts or queries that you might be having? You can use the chat box or you can unmute yourself. Thank you, Bharti. Thank you, Mamta. So, there is no other queries or questions or doubts. Shall we wind up? Sripriya, over to you.
Thank you, Rajika. Thank you for joining us on this evening and taking us through the basics of communication. We hope that everyone would have got at least some knowledge refreshment as far as I guess, because communication is what we do in our day-to-day life, and we do everything on instincts without knowing, without deliberately doing it. Also, we do many things. So believe that this might have been really a refreshing thought for you all. So with the promise that we'll be meeting again in the next session with another eminent faculty and another important topic. This is Sripriya along with Miss Rajika signing off from the Tipsy Hub. Till the next time, stay connected everyone. Be happy. Bye-bye.